A common question I get asked is, how often do I need therapy? How long are therapies? What are we doing? Well, one of the main things to think about when it comes to head injuries and head traumas is essentially it will be a little bit different for everyone. One of the things that you may have noticed is people who have head injuries have a very high fatigue ability. Generally speaking, the longer you do a therapy for, nearing the end, the therapy will probably be useless. Now, this is not across the board because, of course, everyone's a little bit different. But if your metabolic capacity, meaning your system's ability to handle those stimulatory therapies, has reached its limit, that means that doing therapies beyond that point are not very effective. So you always want to stay within the threshold of what that patient can actually handle. Generally speaking, this is why I provide all of my patients exercises to do at home. When the patient can do short, intermittent, small exercises throughout their day, they have a higher likelihood of making improvements because they're pushing on that head consistently. Now, if you're just doing one sit down per day of, let's say, an hour, hour and a half of therapies, well, that could be a little bit over exhausting to the patient, making that potentially a lot of those therapies will be made useless. So, in terms of how frequent you should be seeing the patient in terms of therapeutic approaches, it really depends on how hard you're pushing them and what they're able to handle. So, you have to work within the means of what that individual patient can perform or what they can do, and you go from there. Typically speaking, as they get better with care, as they improve within their symptoms themselves, you'll be able to push them harder and you'll be able to make them do more things to get them kind of moving along. But you really have to go based off of what that patient's tolerances are.